Hello and welcome to TVN TV. My name is Jacqui Fletcher and this is my colleague Fiona Downie. This short video is going to be about medical adhesive related skin injuries and how the Appeel adhesive remover fits into there. Many of you will know Fiona is an expert clinician and for this video she's going to switch between being my patient and also interacting as a clinician as we talk about how the adhesive remover works. So for removing Fiona's dressing I'm going to use the medical adhesive remover wipe. So if I introduce you to Fiona a little bit and she can tell us a little bit about why we might use this. So, hi Fiona, I understand you've been having some problems with having your dressing removed.
Yes, it's been quite painful and it's been sticking quite a lot when the nurse has been trying to remove it.
And how have they been trying to get around that? Have they tried anything else?
So, various different things that didn't work, in fact changing dressing products, but actually it's been the introduction of Appeel, the wipe, that's really been a benefit on the removal of the dressing.
Okay, so let's try this for you. So, important to say when we're using the wipe and that we also need to remember the removal technique for the dressing. So it's not just about the benefits of the Appeel, it's about making sure you remove the dressing properly. So the wipe's quite large, so you need to make sure you get hold of it properly. So that usually means scrunching it up a little bit. And you're going to get hold of the corner of the dressing as you would normally. So you just need to lift a little. Now what you're going to try and do is use the hand that's holding the wipe to keep the tension on the skin. Wipe under the edge of the dressing, and as you're pulling the dressing, you don't want to be lifting it high and lifting the skin. Keep that skin down and pull the dressing gently back as low as you possibly can. So I'm going to work my way around all the edges of the dressing. You don't want to go right the way back with the dressing and across the wound. You're going to lift all the adhesive. And whilst I'm doing that, I'm going to ask Fiona to tell you a little bit about the different ways that you can use Appeel.
Okay, so Jacqui at the moment is using the wipe because this works perfectly for this position of this wound, but actually there are 3 more in the product range and they're all sterile. So we have the medical adhesive remover foam applicator in the Appeel. You may want to use this if a patient is doing their own self-care wound management or one of their relatives, because the foam applicator allows you to be away from the wound as you're applying the Appeel. We also have within the range the liquid sachet. This is really excellent if you have a dressing that's adhered quite significantly to the wound and the surrounding edges, and you might want to add quite a lot of moisture with your remover. We also have the medical adhesive remover spray, which is also sterile, and this is excellent if you have a difficult to get to wound or it's on the underside. So for example, the heel area. So the nurse may actually have to hold the patient's leg up and apply the medical adhesive spray at the same time. So this is excellent. But as I say, with this dressing that I have on today, this is the ideal way of doing it with the Appeel wipe. And I should say they are all sterile, and you would want it to be sterile if you have an open wound or patients with any comorbidities.
And you can see now I've nearly got the 4th edge off. You need to be careful at this point because you're getting close to the wound. You don't want the dressing just to half fall off, and you want to stay in control of that removal, particularly if you've got quite a wet wound underneath there. Just make sure that you've got all the edges lifted. You can sometimes still just get a little bit of it still sticks. We're going to remove that carefully and put it into our rubbish bin.
And that has caused me no discomfort on removal. I could not feel the adhesive coming away from my skin.
So we've seen the technique for removing it, making sure that you're keeping the wipe close to the wound edge, keeping the dressing laid flat. Fiona, I know you've been involved in the MARSI document, medical adhesive related skin injuries. Perhaps you could tell us a little bit more about that?
So the document has been put together so that we can make MARSI easy to understand out in practice, with some top tips in there on how to care for the patient's skin and also what products you'd be wanting to use. So for example, the range that we've just talked you through, we talked to you a little bit about what types of wound you might want to use that for. And I think it's important to stress that this product is actually sterile, so it's ideal for any wound in any situation.
Thank you. We hope you found that helpful and that you'll visit TVN TV again.